Did you know that by age 70, the average person's walking gait decreases by nearly 30%? But here's what's truly fascinating. In certain regions of Japan, elderly people maintain almost the same walking efficiency as those decades younger. Not through expensive equipment or outdoor hiking, but through simple, deliberate indoor walking techniques practiced daily in the comfort of their own homes. If you're over 55, what you do in your hallway or living room could determine whether you maintain strong, confident mobility or join the millions who gradually lose their walking ability due to weather constraints and limited access to safe walking areas. I know that sounds dramatic, but this isn't about fear. It's about opportunity. Because these 5 traditional Japanese indoor walking methods could literally transform your mobility and independence in weeks. In this video, I'm going to walk you through the first of 5 powerful walking techniques that Japanese elders have practiced for generations without ever needing to brave harsh weather or uneven terrain. And the first one, it's not power walking or aerobic. It's actually a gentle heel-toe progression that looks simple but strengthens your walking mechanics faster than conventional exercise. Most Western physical therapists completely overlook it. Exercise 1: Ashifumi Precision Walking. The mindful footwork that retrains your natural gait. What if I told you that one of the most effective walking exercises practiced by Japanese elders isn't about distance or speed, but about the precise way each foot contacts the ground? Ashifumi, literally foot placement, might look like just slow walking, but what's happening in your neuromuscular system while you're doing it is remarkably powerful. Ashifumi has been called walking meditation, and for good reason. According to researchers from Kyoto University's Center for Aging Studies, deliberate heel-to-toe walking with focused attention helps rebuild neural pathways, strengthen foot intrinsics, and most importantly, restore proper gait mechanics. That means it actually helps your body relearn optimal walking patterns, especially in the foot strike sequence that often becomes shuffling and inefficient with age. These are the very same patterns that, when disrupted, lead to decreased stability, reduced walking confidence, and increased fall risk. In fact, a 2021 study from the Journal of Geriatric Physical Therapy found that adults over 65 who practiced precision walking for just 5 minutes, twice daily, significantly improved their stride length, reduced lateral sway, and enhanced their walking confidence within just 3 weeks. But the benefits extend further. Ashifumi also improves ankle proprioception, your sense of foot position, strengthens the often neglected foot arch muscles, and creates greater mind-body connection during walking. The beauty of Ashifumi is that it requires only a straight path about 10 to 15 feet long, perfect for a hallway or along one side of a living room. Even better, it combines physical movement with mindfulness. Each step becomes an opportunity to rebuild the neurological foundations of walking that naturally weaken with age and sedentary lifestyle. Exercise 2: Kenkai Stepping. The side-to-side movement that builds lateral stability. You've probably seen people shifting weight from foot to foot while standing in line, but did you know that a specific Japanese side-stepping technique, called Kenkai, can dramatically improve the lateral stability that conventional forward walking completely misses? According to a study published in the International Journal of Geriatric Rehabilitation, adults who practiced side-stepping movements for just 6 minutes daily showed a 37% improvement in lateral stability tests after just 4 weeks, a crucial metric for preventing sideways falls, the most dangerous type for hip fractures. But here's the twist. It's not just about moving sideways. It's about what happens in your hip stabilizers and ankle proprioceptors during those controlled lateral steps. Kenkai stepping engages the gluteus medius, tensor fasciae lati, and peroneal muscles, the exact muscles responsible for stabilizing your body when you're bumped sideways, step off a curb, or need to quickly adjust your balance on uneven surfaces. These crucial muscles are barely activated during forward walking, which explains why many seniors who walk daily still experience lateral instability. But here's what most people miss. The foot position and weight transfer technique matter tremendously. In proper kenkai, you fully transfer weight from one foot to the other, momentarily standing on a single leg before each side step. This brief single-leg stance creates what Japanese movement specialists call stability challenge moments, precisely the skill your body needs to recover from unexpected balance disruptions. Even better, according to research from Osaka University's Department of Preventative Gerontology, lateral stepping improves hip joint mobility and strengthens the hip abductors, critical factors in preventing the narrowed, unstable gait that often develops with age. So, forget walking in just straight lines. Your side-stepping practice is your medicine for comprehensive stability. And if you practice near a wall or countertop for safety at first, it becomes confidence-building therapy for both body and mind. Now, the next technique on our list isn't just for balance. It's a toe-walking method that strengthens your calves and feet while improving your overall walking posture. Let's get into it. Exercise 3, Sumadachi Toe Walking. The calf strengthening technique that improves push-off power. If you've noticed your steps becoming shorter and your walking speed decreasing with age, you're experiencing one of the most common mobility changes in seniors: reduced push-off power. But what might surprise you is that a simple Japanese toe-walking technique, called sumadachi, can rebuild this crucial walking component better than conventional exercises, all within the comfort of your own home. Why is sumadachi so effective? Because it specifically targets the gastrocnemius and soleus muscles, your calves, and the intrinsic foot muscles that provide the propulsive force in efficient walking. According to researchers from Tokyo Medical University's Gait Laboratory, these precise muscles weaken nearly twice as fast as leg muscles in adults over 60 when not specifically trained, leading to the characteristic shuffle that many associate with aging. In an impressive 2018 study published in the Archives of Physical Medicine and Rehabilitation, older adults who practiced gentle toe walking for just 3 minutes daily showed a 26% increase in ankle plantar flexion strength and significant improvements in walking speed and step length after 6 weeks. The research team was particularly interested in how this simple exercise improved what's called terminal stance push-off, the critical moment in walking when your calf muscles propel you forward into your next step. The traditional Japanese practice begins much more gently than Western toe walking exercises. Dr. Haruko Takahashi, a specialist in geriatric rehabilitation, explains, "We don't start with actual walking. We begin with gentle heel raises while standing in place, holding support if needed. Only after the ankles gain strength do we progress to actual toe walking. This graduated approach prevents strain and builds confidence." Here's how to practice traditional sumadachi at home. Start by standing near a wall or countertop for support. Gently rise onto the balls of both feet, lifting your heels just 1 to 2 inches off the ground, far less than a ballet dancer's releve. Hold this slightly raised position for 3 to 5 seconds, focusing on balance and calf engagement. Then slowly lower your heels back to the floor. Repeat this stationary heel raise 8 to 10 times before resting. As your strength and confidence improve, progress to walking 4 to 5 steps while maintaining the slightly raised heel position. The key is not height but control. Keep your ankles stable without wobbling. Japanese elders focus on what they call quiet feet, moving smoothly without thumping or harsh impact. What makes this technique particularly valuable for indoor practice is its small space requirement. Even a 6-foot section of hallway provides enough room for effective practice. This accessibility ensures consistent training regardless of weather or outdoor conditions, a crucial factor in establishing lasting mobility improvements. For those concerned about safety, sumadachi can be entirely practiced with fingertip support on a wall or furniture. Miyuki Sato, an 86-year-old practitioner from Nagano who has maintained remarkable walking ability, shared her experience. "I began with just standing rises while holding my kitchen counter. After 2 weeks I could feel my steps becoming more lively, and now I can walk through my entire house on the balls of my feet if I choose."